Thankfully, I have been lucky in that the disease has not touched me or my family personally, but I have 2 sisters, I have a mother, I have 4 daughters, I have a wife, and it is something that's very important to me. I know that breast cancer is a very common disease. Somewhere between 1 in 9 and 1 in 11 women, unfortunately, will get breast cancer in their lifetime. That perspective, which many of us have, is part of my interest and passion for breast care. One of the things I really enjoy about surgery, aside from the operating room, is the chance to build rapport with patients and interact with them. I actually enjoy teaching patients about the disease process and about what they're going through. Breast cancer, especially, is a challenge when talking to patients, just because they're overwhelmed when they receive a diagnosis of breast cancer or pre-cancer. And at the end of our discussion, they actually have to take a very active role in choosing their treatment plan. And in order for that to happen, they really have to understand the choices they have ahead of them and the nuance of those choices. And that takes time and effort. First and foremost, I reassure most of them that breast cancer is very survivable, and especially early stage disease, the vast majority of patients do extremely well with appropriate therapy. The initial message is, when possible, to try to help to alleviate some of the anxiety that they feel. And that's also part of the education process. I think the knowledge is power. The more patients know about what they're dealing with and their prognosis and what they have ahead of them in terms of treatment, the better they can kind of deal with that challenging diagnosis. The approach of the Center for Breast Health is to provide comprehensive, cutting-edge, collaborative care. And that's really the beautiful thing about the Center for Breast Health. We have radiologists who are experts in their field, who are right next door, who aid us with diagnosis. We have a genetics clinic, one of the first in the area, that helps with the analysis of the evolving field of genetics and how it impacts inherited forms of cancer. And then we work closely with our medical oncologists and our radiation oncologists as well through the Center for Breast Health. From a surgical perspective, the treatment of breast cancer has evolved towards a minimally invasive approach. And that means that, in general, we try to preserve the breast whenever possible, and we perform small outpatient surgery. And we also try to minimize the surgery that we do on the lymph nodes, which can decrease the chances of problems like nerve damage or arm swelling. Collectively, we have over 100 years of surgical experience, and we can produce outcomes that rival those of any center, but we can do it right here in our own community.